Hi, and welcome to Itty Bitty Orphan Kitty Rescue's Raising Orphan Kittens presentation, part 2 in our Kitten Fostering 101 training program. We hope that by watching this video, you'll learn everything you need to know to become a foster parent for very young kittens so that you can help save tiny kitten lives. The training consists of a short presentation, of bottle feeding demonstrations with kittens, and some Q&A. So why are you here? Well, you want to learn how to care for neonatal kittens so that you can be an overnight foster home for the San Jose shelter. You want to be a foster home for neonatal kittens for IBOK Rescue or another local rescue. Or you want to know how to care for neonatal kittens in case you find them on your own. What is a neonatal kitten? A neonatal kitten is the kitten at its tiniest, when it is newborn to 4 weeks old. Neonatal kittens are unable to eat on their own and require bottle feeding and around-the-clock care. Neonatal kittens that are surrendered to the municipal shelters are euthanized if a rescue group doesn't take them within a few hours. If you find kittens without a mother cat present, don't immediately assume that the kittens are orphans. A lot of times the mom can be off hunting for food and will be right back. If the kittens are safe, observe them quietly from a distance to see if the mother returns. If the kittens are clean, plump, and sleeping quietly, chances are that they've got an attentive mom and should be left alone. So how old is your kitten? Knowing the age of your kitten is important as a kitten's needs change week to week. A 1-week-old kitten will require completely different care than a 4-week-old kitten would. So determining your kitten's age is vital so you're able to provide it with age-appropriate care. So kittens in week 1, days 1 to 7, they're born blind and deaf. They can't hear you, they can't see you. Their only sense is warmth. Their eyes are closed and their ears are folded down. They are pinkish and smaller than your hand. And the umbilical cord will remain attached for about 3 days. So if your kitten has an umbilical cord, it is likely 4 days old or younger. Week 2, 8 to 14 days, the eyes begin to open, usually between 8 and 10 days old. Do not try to force their eyes open. Please let them open naturally. Eyes are blue, but most will change at around 4 weeks. And watch for signs of eye infections. They can develop eye infections even before their eyes open. Week 3, days 15 to 21, kittens will start to wobble around and explore. Their ears are erect and their eyes are wide open, and baby teeth start to come in. If your kitten has baby teeth, they're likely around 3 weeks old or older. Week 4, 22 to 28 days, kittens are more active and mobile. Their eyesight is improving and hearing is very well developed. They should be dewormed at around 3 weeks old, and you can offer a shallow plate of water and introduce them to the litter box. Week 5, 29 to 35 days. Kittens are no longer considered neonatal at this point. They should weigh about 1 pound and be running around. You can begin weaning them with canned kitten food. Usually add a little bit of hot water to that canned kitten food to make a little bit of a gruel. It's much easier for them to eat, and the warm water brings out the scent, which makes it a little bit more interesting for them. And they should also be using the litter box on their own. Not always consistently, but for most part, they should be using their litter box at this age. Week 6 to 8, that's 36 to 60 days old. Kittens should be eating mostly solid food 4 times a day. They could still be having a little bit of a bottle. We don't always like to take their bottle away before they're ready to say goodbye to it. It's better for their emotional health. They can get their first FERCP vaccination around 5 to 6 weeks old. And then at 2 months, 2 pounds, they can safely be spayed or neutered and placed up for adoption. So when you're ready to take your kittens home, you're going to want to provide warmth and first aid. It's important to keep the kitten warm. If you don't have a warm nest set up already, immediately place your kitten under your clothes next to your skin so he doesn't become chilled. Kittens less than 1 week old should be kept between 88 and 92 degrees, which is pretty warm. Kittens 2 to 4 weeks old will still need to be kept very warm, about 80 degrees. When you get your kitten home, find a place that is warm, draft-free, and isolated from other pets. Create a nest in a pet carrier or a sturdy box with layers of soft blankets and a snuggle-safe disc or heating pad turned on low. Make sure if you're using a heating pad, it doesn't have an automated shutoff. And never feed a chilled kitten. Always warm them up before feeding or they can go into shock and die. So even if your kitten is crying for food, you're going to want to make sure that their body temperature is warm before you start to feed them. A feeding demonstration will follow this presentation. We'll have a little video showing how to feed live kittens. In the meantime, we're going to talk about how to feed your kitten. You're going to want to place its stomach down on a towel or a blanket. You can use your chest or a table, but you just want to make sure that you've got that kitten laying on its stomach and definitely not on its back. Open its mouth gently with the tip of your finger. Slip the nipple between its jaws and hold the bottle at a 45-degree angle. You're going to gently pull on the bottle until they suckle. If you force the bottle into their mouth, they're going to back away and not grab on. But if you pull a little bit, sometimes they chase it and they grab on and latch on. You want to see them latching on and actually sucking, and you'll see their little ears wiggle. It's really cute. Never feed a kitten on its back, always on its stomach. If formula gets into its lungs, immediately hold your kitten upside down until the choking stops and the airway is cleared. You can have them in your hand, laying on their back in your hand, and gently swing your arm backwards and let gravity do the work of trying to clear that formula from its nasal or lungs. If your kitten is too weak to suckle, you're going to seek veterinary assistance immediately. But of course, contact your foster coordinator first for vet authorization. Do not use cow's milk to feed your kitten. All kittens must have a kitten formula like KMR. There are several different brands of kitten formula out there. KMR is our favorite, but there's Petlac and many other different ones. You just want to make sure that whatever you start with is one that you stick with. Consistency is very important for their little intestines. Never force feed your kitten. You're going to want to let that kitten suck the fluid from the bottle at its own pace. Only allow enough formula to go in its mouth that it can easily swallow. Gentle pressure can be used to start the flow of formula so the kitten gets the idea, but you definitely want to let that kitten decide how much formula it's going to have coming in its mouth rather than you putting too much in there that it can't swallow. Make sure to clean and sterilize all utensils before and after feeding. Formula should be warmed to the kitten's body temperature and fed to very young kittens every 2 to 3 hours. Do not use a microwave to heat that formula. Instead, you can place the bottle with the formula in a cup of hot water to keep it warm. In between feedings, you can put it back in the warm water to keep it from getting too cool. A kitten needs approximately 8 cc's of formula per ounce of body weight per day. The kitten's age determines the number of daily feedings it should receive. And kittens should be weighed frequently and gain approximately 4 ounces per week. Here's a little chart to give you some idea. A 1-week-old kitten typically weighs around 4 ounces, and it's going to need about 32 cc's of formula per day and probably spread out over 6 to 8 number of feedings per day. A kitten that's 4 weeks old is going to weigh about 13 ounces, require 104 cc's of formula per day, and probably will be needing to be fed 4 to 5 times per day. There's a copy of this feeding guide in our Raising Orphan Kittens handout. Aspiration pneumonia. The biggest concern with bottle feeding is aspiration. When the formula goes through the larynx, down the trachea and lungs, instead of through the esophagus to the stomach. This condition is almost always fatal, so be very careful that your kittens do not inhale their formula. The most common causes of aspiration are feeding a kitten on its back, squeezing the bottle, forcing too much formula into the kitten's mouth and they're able to swallow, syringing the formula into the kitten's mouth too fast for them to swallow, the nipple opening is too large for the age of the kitten is too weak to suckle, or there might possibly be a congenital deformity of the soft palate. Kittens do not go to the bathroom on their own. Mom cats help them do that by licking their little bottoms to help them pee and poop. We're not going to ask you to lick their bottoms, but you're going to have to help them to urinate and defecate by stimulating them. You gently rub the kitten's bottom with a moist cotton pad or a moist tissue or paper towel until they have urinated. Usually takes about 20 seconds of gentle rubbing on their bottoms to get them to urinate. kitten should have a bowel movement about every 24 to 36 hours. If your kitten has diarrhea, you're going to want to wash its bottom with warm water under a gentle running faucet, or dip them into a bowl of warm water rather than actually wiping, because you can cause the diarrhea and the wiping can cause irritation. If your kitten has fleas or other parasites, you're going to want to rid them of those as soon as possible. Flea anemia is another cause of kitten death, and we want to make sure that our kittens are not having all of their blood sucked away by fleas. A flea comb with the warm water with liquid soap in it is the safest. You comb the fleas out of their fur and drop those live fleas into the bowl of water where they drown. You can also give them a warm bath. Do not use over-the-counter flea products or shampoos. Blue Dawn dish detergent is usually the safest. You're going to also want to watch for tapeworms. Kittens that have been infested with fleas likely have swallowed some of those fleas, and it will in their body turn into tapeworms. Tapeworms look like little grains of rice, and if your kitten has tapeworms, they're going to require a different type of dewormer than we normally give. Diarrhea can be an indicator of parasites or other intestinal problems. So if your kitten has diarrhea, you may have to have them checked out by a veterinarian or by your foster coordinator to determine what type of treatment that kitten might require. So when your kitten gets close to a pound, about 4 weeks of age, you can actually begin weaning them with the high-quality canned kitten food mixed with warm water. As your kitten eats more often from the bowl or the plate, you can gradually reduce the number of bottle feedings, but don't stop until you're sure he is eating enough on his own. Changes in diet can cause diarrhea, which can be life-threatening, so please let us know right away if your kitten has diarrhea. You can also start litter box training at this age. At 4 weeks, you can introduce your kitten to the litter box, but only use kitten-safe litter. Clumping clay litter can be very damaging to them if they were to ingest it. We recommend a corn or wheat-based litter, so in case they accidentally ingest it, it won't cause them any difficulties in their intestinal tract. You want to place your kitten in the box for a minute or so before and after each meal. You can also hold your kitten over the box while you stimulate and place the soiled tissue in the corner of the box to help give it the idea. That tends to speed up their understanding of what that litter box is all about. Your kittens can develop health problems. Orphan kittens are especially vulnerable to diseases. At the first sign of any abnormal behavior or loss of appetite, please contact your foster coordinator. Things to watch for are upper respiratory infections. We call them URIs. It's sneezing, nasal discharge, runny or swollen eyes. Diarrhea, of course, and reduced appetite or refusal to eat. Signs that your kitten is sick and may require veterinary care are loss of appetite, refusing to take the bottle for more than one feeding, diarrhea lasting longer than 24 hours, vomiting or coughing, lethargy if they're weak and sleeping too much and not active, or discharge coming from the nose and or eyes. So what if your kitten won't take the bottle? The nipple opening could be too small. The formula may be spoiled or not the right temperature or consistency. The kitten could be too weak to suckle. You can try syringe feeding a little formula in there to get things started. Sometimes a syringe works better than a bottle for a kitten who doesn't understand what's happening. What if your kitten seems lethargic? If your kitten's not very active and seems to be lethargic, you want to maybe try a drop of Karo syrup on its gums. That sometimes the sugar of that can boost its energy. You want to make sure your kitten is warm enough. A cold kitten is often going to seem more lethargic than a warm kitten. If the gums are pale and your kitten is listless, you want to contact your foster coordinator for authorization to seek vet assistance immediately. It's likely your kitten has flea anemia. How do you know if your kitten is dehydrated? You want to pinch the skin on your back of your kitten's neck. If it stays up and doesn't spring back quickly, your kitten probably needs fluids and is dehydrated. You can try using a 4-to-1 water to formula ratio and or use unflavored Pedialyte instead of water to give them some electrolytes. You can also give subcutaneous fluids. Your coordinator can administer them for you and even show you how to do it yourself. Why won't your kitten poop? Kittens should urinate before and after every feeding, but will only pass stool every 24 to 36 hours. You can try gently massaging the tummy with warm hands and then stimulating his bottom with a warm, moistened tissue for 60 to 90 seconds, which is about 30 to 60 seconds longer than you would normally do for urination. If your kitten needs to poop, you're going to feel contractions in his stomach like he's trying to push, so you're going to want to keep on gently, very gently stimulating his bottom until he's able to pass that stool. You can also place a small amount of Vaseline or KY gel on the anus if your kitten is constipated. That will help it pass through without causing him pain. If you have no stool for 48 hours or more, you're going to want to contact your foster coordinator so we can figure out what might be going on and what he might need. So what if you have the opposite problem and your kitten has diarrhea? Change in formula or diet can be the cause, so you might want to take a step back. If you've just begun transitioning to solids, you might want to go back to just formula for a day or two and see if that resolves the issue. He may also need a probiotic, a dewormer, or even an antibiotic if he's got a bacterial infection. If stool is watery or diarrhea lasts more than 24 hours, your kitten should see a veterinarian. Bring along a stool sample if you can, and you'll also want to check in with your foster coordinator and get authorization to get that kitten to one of their veterinarian partners. Diarrhea and the resulting dehydration can be life-threatening to a small kitten, so it's really important that we act quickly and get that kitten the help that it needs in order to get healthy. So here are some resources in case you run into trouble. The stages of kitten development and Raising Orphan Kitten handout that we give out at our trainings can be downloaded from our website at ibokrescue.org. There's also a couple of orphan kitten groups online that you can join. While you always want to follow your foster coordinator's instructions and advice, you can still sometimes learn some things by participating in discussions with other people who are raising orphan kittens like you. And there's the Cat Resource Center located in Santa Clara County that's got a lot of information about cat issues. And Alley Cat Allies, they have a wonderful newborn kitten manual that is very comprehensive that you can download and read as well. Please keep in mind, caring for an orphan kitten can be difficult, and even the most conscientious foster parent may lose a little one. If a kitten dies, you should not blame yourself. It can happen to even the most experienced foster parent. A kitten is most likely to die at birth, in its first week, or during the weaning process. But armed with common sense and accurate information, you have a good chance of raising a motherless kitten to the adoption age and giving him or her a chance to have a good life. Please be sure to spay or neuter your kitten if you're doing this on your own without rescue support. Spay and neuter that kitten before letting them leave your care. And remember, over 3,500 kittens under 8 weeks old used to be euthanized in Santa Clara County every year. Through our efforts, we are working to change that. Their live release rate is now around 90%, which is fantastic for a municipal shelter. Rescues step in and they take a lot of those kittens out of that shelter, and we need foster homes like you that can care for them until they reach an adoptable age. Never give away an unspayed or unneutered kitten. I can't say that enough. And kittens 8 weeks old and weighing at least 2 pounds can safely be spayed and neutered and placed up for adoption. If your vet is telling you to wait until they're 4 or 6 months, please don't listen to them. Kittens can go into heat as early as 4 months old, and then you have kittens on your hands, so please spay and neuter early. And you can make a difference and give these innocent kittens a chance at a safe and healthy life. Do you have any questions? Questions can be emailed to us at info@ibokrescue.org, and we'd be happy to respond by email to you and help answer any questions you may have. So hopefully you've learned enough that you're ready to start feeding baby kittens. Before you get started, however, you're going to want to make sure you have all of the supplies that you may need at hand. We recommend using KMR powdered. You mix it with water, follow the directions on the can. They also have pre-mixed KMR formula that comes in a can that it's ready to go. It's a little bit thick and it sometimes causes diarrhea, but it is very convenient. So you need to decide which kind you want to use. There are a lot of different types of bottles. We prefer the 4-paws nurser because it collapses and it's much softer plastic than the pet egg. However, any bottle will do. There are a lot of different types of nipples that you can choose from as well. The nipple that comes on the 4-paws nurser is a cone shaped, and you want to do a crisscross snip at the top just so that a little bit of formula can dribble out onto your wrist when you hold it upside down. You don't want it to pour out. For very tiny kittens, we recommend that you use a miracle nipple. They are truly miracles, and they prevent aspiration pneumonia more than any other nipple that we've ever used. They are quite expensive, but your foster home or your foster coordinator should be able to provide you with one. And as mentioned earlier, if for whatever reason your kitten is just not latching on and not suckling from the bottle, you can always try using a miracle nipple on a syringe where you have a little bit more control of how much formula you're going to put in that kitten's mouth at a time. And just squirt a little bit in, let them swallow, squirt a little bit more in, let them swallow. And you can use the syringe, the numbers on the syringe, to measure how much formula that kitten did take at that feeding. Here is a little video of us bottle feeding a kitten that is about 3 or 4 days old at this point. You can see that the kitten has latched onto the nipple. The little tongue is in a U-shaped and has completely encircled the nipple and has a good grip. You can, if you look really closely, the ears are folded down because this kitten's pretty darn tiny, but you can see that the little ears are moving very, very slowly, wiggling back and forth. The kitten is drinking at its own pace. There might be a little bit of pressure put on that bottle so that it will help it collapse without any air entering the baby's stomach. But it does have a good grip, and it is drinking at its own pace. When it's done eating and it's had enough, he will let go of the nipple, and you have to kind of make sure that their little head doesn't fall over. And you can tell that this kitten is really small, that he is so small that the Beanie Baby that he's laying on seems humongous when in fact it's really quite small.